This is part 3 of cervical vertebra projections. We're going to look at the lateral projection. Image analysis guidelines for the lateral cervical vertebra projection state that the anterior and posterior aspects of the right and left articular pillars and the right and left zygapophyseal joints of each cervical vertebra are superimposed. We'll see later on what we really mean by that, but you can see the articular pillars here. They're highlighted here. And your zygapophyseal joints. They should be nice and superimposed and clean. There should be no, it almost looks like it's like a double vision or blurry vision when you see rotation. The mandibular rami should be superimposed, okay? The spinous processes should be in profile posteriorly. The superior and inferior aspects of the right and left articular pillars and zygapophyseal joints of each cervical vertebra should be superimposed. The intervertebral disc spaces should be open. The posterior arch of C1 and the spinous process of C2 are in profile. There should be no superimposition posteriorly by the occiput, okay, over your over the cervical vertebra. The bodies of C1 and C2 should be seen without the mandible superimposing them. The long axis of the cervical vertebra should be aligned with the long axis of the exposure field. The sella turcica, 1st through 7th cervical vertebra, and superior half of the 1st thoracic vertebra and the surrounding soft tissue should all be included within the exposure field. You'll see the image analysis guidelines clearly stated here for your review. So now let's look at some positioning errors. In this first projection, we wanted to determine about cervical and cranial rotation, and how do we determine that? The first thing you want to look at is the mandibular rami. If one appears to be not superimposing the other, then there's an indication of some rotation here. And you can see that these mandibular rami are not superimposed here. The second area to look at is at the articular pillars and the zygapophyseal joints. If you look here, especially right here, you can see there's double lines, basically. The articular pillars and the zygapophyseal joints, one is anterior to the other instead of exactly superimposed, looking as if it's one vertebra. And those spinous processes would be more in profile as well. It is very difficult to determine, which side of the patient is rotated towards or away because of the cervical vertebra being so identical on each side. The best suggestion is to go back out to the patient and ensure that that mid-coronal plane is perpendicular with the IR. You also want to ensure that the interpupillary line is also perpendicular with the IR to ensure that there is no rotation in the cranium or head. This is another example of rotation. As you can see in the magnified view down here in the right-hand corner of the zygapophyseal joints, one is anterior to the other as well as the articular pillar. So we have one shoulder that is rotated in front of the other. So we definitely need to go back out and make sure that mid-coronal plane is parallel or perpendicular to the IR. Another positioning error that can occur is when the zygapophyseal joints look like one is superior to the other. As you can see in this magnified box in the corner, that the zygapophyseal joints, there's like double lines there. And basically what happens is the patient's head is tilted. That should indicate that we may need to ensure that interpupillary line is perpendicular with the IR. There's no rotation, just head tilt one way or the other. When the head is tilted away from the IR, there are some things that we can look at to determine how to fix the tilt. Separation of the right and left articular pillars and those zygapophyseal joints is present, okay? The inferior cortices of the cranium, as you can see right here, they will not be superimposed as they normally are. And you'll see the posterior arch of C1 remains in profile. When it remains in profile, the head is tilted away from the IR. You'll see in the next picture when the head is tilted towards the IR, that posterior arch is not in profile, and you actually visualize the vertebral foramen. Let's take a look. So as previously stated, when there is tilt towards the IR, the head is tilted towards the IR, the vertebral foramen will be well visualized. So you need to correct this by getting the interpupillary line perpendicular with the IR. Again, we can tell that this is tilt rather than rotation, because the separation of the right and left articular pillars and zygapophyseal joints are demonstrated superiorly and inferiorly. They give this little double line look here, whereas when it's anterior to posterior, the zygapophyseal joints move away from each other, or the articular pillars move one anterior to the other. You'll also look at the inferior cranial cortices to determine if there's head tilt. And again, the way to determine which way the head is tilted is by that vertebral foramen. If it's visualized, the head's tilt towards the IR. If it's not visualized, but there is indication of tilt, then the head is tilted away from the IR. And remember, with rotation, it is not easily identified which side of the patient is rotated. You need to go back out and readjust the patient so that their mid-coronal plane, again, is perpendicular with the IR. If you recall, image analysis guidelines require us to position the patient so that the mandibular rami are not superimposing the cervical bodies of C1 and C2. If the chin is not adequately elevated to the position where the acanthomeatal line is parallel with the floor, one or both of those mandibular rami will superimpose over C1 and C2. And so therefore you will need to repeat this image because there should be no superimposition. Basically, the chin should be parallel, or the mandible should be parallel with the floor. in order to ensure correct positioning. So let's look at our first practice analysis. First, you want to make sure that we have all the anatomic structures on. And so you want to make sure that we have from the sella turcica, which is not well visualized, but it's up here, okay, down to the first thoracic vertebra. And we do, because this is C7 here, okay. So we do have all our anatomy. However, we need to determine whether or not we are well positioned. So first you want to look for rotation. Where can we look for that? We can look for that in the mandibular rami, and we can also look for that in the articular pillars, and which are right here. And looking at these articular pillars and the zygapophyseal joints, one to me looks anterior to the other. And so that indicates that there is some rotation in this image. In order to correct the patient positioning, we need to rotate the patient until their mid-coronal plane is perpendicular with the IR. In our next practice analysis, again, you want to look for all your anatomic structures. Are they present? Do we have C1 to C7? Count them. If we do, then we are good. In this case, we do. But next, you want to determine whether or not we have any type of rotation or tilt. And so we're going to look at the cervical articular pillars and the zygapophyseal joints. Again, in this projection, one is anterior to the other. You can see that right here. So that should indicate to you that there is some rotation. You can also look at the mandibular processes as well, or rami, sorry. In this case, we really do need to look at the position because they are superimposing the cervical body, C1, C2. My highlighting is not going very well here today. And so we have a acanthomeatal line adjustment we need to make. So in order to correct this imaging errors, we need to repeat this, get the mid-coronal plane parallel with the or perpendicular with the IR, and adjust that chin so that the mandible is parallel with the floor to clear C1 and C2. In our last lateral projection here, again, you want to check to see if we have all our anatomic structures. In which we do have our structures, however, are we positioned appropriately? So we're going to look for rotation. Are the articular pillars and the zygapophyseal joints superimposed? And in this case, they are not superimposed. One looks like it is superior to the other. We're getting those double lines right here. If you look at these articular pillars, one is sitting on zygapophyseal joints, one sitting on top of each other. That should indicate to you there is some head tilt. You also want to look at whether the occiput is superimposing the C1 or the mandible, and in this case the occiput is. So we will make sure that when we correct this image, we need to make sure the AML is aligned parallel with the floor. You also want to look at these posterior cortices. They should be superimposed, and I see double lines there. So again, that should indicate to you that we have some head tilt. So how do we determine which way the head is tilted? We're going to look for that foramen, and I'm going to erase this right here. But if you take a look, the foramen is starting to show inferiorly here. So that should indicate to you that the head is tilted towards the IR. So we need to correct a couple things. One, head tilt, which will mean that the IPL, or the interpupillary line, should be aligned perpendicular with the IR. Bring the chin down so the AML is aligned with the line parallel with the floor to correct this imaging. This concludes our lateral projection image analysis. Please continue on to part 4.